In New South Wales, we had 127,000 tests to 8 p.m. last night, which is always a pleasing result, and we're so grateful people are coming forward to do the right thing. We had 415 cases of community transmission, so a welcome drop from yesterday, but obviously much more work to be done. We just ask everybody to please stick to the rules, stay home, get tested if you have symptoms, stay home again until you get the results, and of course, come forward and get vaccinated. Of those 415 cases of community transmission, at least 35 were infectious in the community, and that number is likely to go up as cases under investigation are consolidated. Regrettably, 4 people lost their lives to 8 p.m. last night. A female in her 50s from Western Sydney at Campbelltown Hospital who wasn't vaccinated. A female in her 70s at Royal North Shore Hospital who was only recently given her first dose, so wasn't protected. A man in his 80s at Liverpool Hospital who wasn't vaccinated. A female in her 80s at RPA who was vaccinated but did have underlying chronic conditions. Again, our heartfelt, deepest sympathies and condolences to all of their loved ones. Please know the last thing we want to see is more deaths because of this outbreak, but unfortunately we know that's what we're going to see unless we reduce case numbers and unless we increase the rate of vaccination. In relation to where the most concerning areas are, they remain, of course, in Western and Southwestern Sydney. We've seen stabilisation and reduction in some local government areas where there's been that intensive activity and increasing rates of vaccination. But the main suburbs that we're now concerned with, which are showing considerable growth in cases, and please know if you're in these areas, you need to not only take extra precautions, but make sure you come forward for testing and stay home. Do not leave home unless you absolutely have to. That's Blacktown, Mount Druitt, Marryong, Marylands, Auburn and Guildford. These are the suburbs of most concern in the entire state. And we really need people to stay home. And the only reason you should really be leaving home, unless you absolutely have to get an essential food product, is really to get vaccinated, and that's it. And can I also make comment, and the Deputy Premier is here, and thank him for his support in relation to our regional New South Wales strategies, that there is stabilisation in the Hunter region, which is positive, but Western New South Wales remains a concern, especially in relation to our vulnerable Indigenous communities, and getting vaccine to them is critical at this point in time. On a very positive note, New South Wales hit 5 million jabs. Thank you, everybody, for coming forward to get vaccinated. Outstanding result that in New South Wales we now have hit 5 million jabs, and 50% of our population has received their first dose. So that is a very pleasing result. Thank you. If we keep that up, we can look forward to hitting those vaccine milestones, hopefully on the schedule that we have, but if we do really well, obviously that can happen more quickly. I was very pleased with the announcement the Prime Minister made shortly before this press conference to say that New South Wales will be receiving an additional 500,000 doses of Pfizer. Please know we'll be putting that to very good use. We'll be targeting 16 to 39-year-olds in those local government areas of concern. They are the ones that are mobile because of their work. They are the ones who cross 3 generations, and they are the ones who are part of the 70% of cases that we're currently experiencing in those most problem areas. So I'm very pleased with that, and please know those will be going to good use, and that is in addition to the 100,000 we'd already allocated for authorised workers this week. And today is our big construction worker and tradie day. So we're hoping that at least 10,000 people will get vaccinated today, specifically in the construction and tradie occupations. But of course, commencing Monday and over the next 2 or 3 weeks, we'll have a bumper run of vaccinations. And I'm pretty convinced that the week of the 16th and the 23rd of August will have the highest rates of vaccination our state has seen. So it's really pleasing that we're getting those doses up. But can I stress to people, please come forward and get vaccinated. Don't be too fussed on what vaccine you're offered. But obviously certain ages, especially those who are 16 to 18-year-olds, can only take one type of vaccine. But don't be fussy. Get your hands on whatever vaccine you can and please get vaccinated. The quicker we hit those targets, the safer our community is and the greater opportunity we have to reduce the spread. Thank you.